Cotard syndrome. What is Cotard syndrome? Nihilistic delusions. The patient, it is also called as walking corpse syndrome, where typically the person will go into a delusional belief that he is dead, he does not exist, he is putrefying, he has lost his internal organs. That is what a patient will develop, a delusional crisis which is called as Cotard syndrome. So it occurs in older individuals who are depressed, who realize that the time on the planet Earth is over, they are going to have the visa to go to heaven. They go into a nihilistic delusion when they are depressed, and that is called as Cotard syndrome. Is what it doesn't include auditory hallucination. Now, doctor, which is a cannabinoid? Marijuana is a classical example, and even the hashish and hashish oil. So what are the first rank symptoms, positive symptoms, negative symptoms of schizophrenia? Everything on schizophrenia. Without that there is no question paper. Auditory hallucinations. Hearing that the other people are conversing with you. Thought echo, somatic hallucinations, passivity phenomena, thought withdrawal, thought insertion, thought broadcasting, delusional perception. They are all considered to be the first rank symptoms of the schizophrenia, is what you have to ultimately remember, doctor. Now, electroconvulsive therapy. What are the indications? Once more, very high yield topic. Same question if it comes in the next state MD entrance going to come in Sunday, there is no surprise. Contraindications, prerequisites, absolute and relative among contraindications, everything you must know about ECT. So doctor, it is used in schizophrenia, depression, severe maniac episodes. In all these scenarios we use the electroconvulsive therapy, is what need to be remembered. Modafinil. Where do we use, doctor, modafinil? Modafinil is used and indicated for management of the narcolepsy, basically. A lot of times this was a previous question. Gallium accumulates in the abscess cavities, is what need to be remembered. Intracranial calcification within the skull, don't confuse it with intracerebral calcification, is a typical feature of meningioma, is what you need to remember. So normally pineal gland, dura, basal ganglia, they all show calcification. Among tumors, craniopharyngioma, meningioma, AV malformations, they all typically lead to intracranial calcification. Carcinoid lead to calcification of the heart wall, which is a true statement. Echo can detect pericardial effusion as little as 15 ml, is what you need to remember. In ASD, what you typically see, doctor, there is an increased blood flow from left to right side and more blood flow to the lungs. Hence pulmonary plethora is what you typically come across. This is a beautiful question on the breast cancer, doctor. Definitely a similar question will come in the forthcoming state entrance. American Journal, American Society for Cancer, since it is 3 centimeters node in right supraclavicular fossa with a 5 centimeter lump in right breast, that is ipsilateral supraclavicular fossa is involved. So that makes it T3N3M0. It is T3 because of the size of 5 centimeters. You need to once more review the HSCC classification. If you take papillary carcinoma, classically it is treated to be a multifocal entity, is what need to be remembered. Helicobacter pylori, definitely one question will come. So this patient who is having chronic antral gastritis, we use the Martin starry stain, is what need to be remembered. This is a beautiful question, doctor. Counard segment, what is the nomenclature based upon? It is the hepatic vein, portal vein. So you should remember, according to the Counard nomenclature, the middle hepatic vein divides the liver into right and left hepatic, into the right and left hemiviews. Each of this is further subdivided by the right and left hepatic veins into medial and lateral sections. And in turn, each of these sections is divided into anterior and posterior segments by the branches of the portal vein. Hepatic vein, portal vein form the basis of the Cunard's classification. It is not the other options. If the same question comes, doctor, only you will be answering it correctly. Be very sure. Cunard's classification. The patient has got diarrhea, increased alkaline phosphatase, means he has an inflammatory bowel disease with increased alkaline phosphatase, means we will basically think of sclerosing cholangitis is what need to be remembered. It is increased oxalate absorption which is responsible for the renal calculi whenever you do the massive bowel resection is what need to be remembered. What is the cause for abdominal distension in obstruction, doctor? It is the swallowed air which is the main component responsible. So you put a rail tube, you can bring out all that swallowed air. In appendix, it is the carcinoid which is the most common tumor is what you need to remember. Solitary rectal ulcers generally they involve anterior wall rather than posterior wall. Now doctor, the penile area, root of the penis and adjacent part of the scrotum, it is a genital branch of the genitofemoral nerve which is basically responsible. It is the uretero-vesical junction which is considered the narrowest part. This is a very classical question. Retropubic prostatectomy. What is the troublesome source of bleeding? It is the dorsal venous complex is what you have to fundamentally remember. Bulbar urethral rupture. Typically, you find bleeding per urethra, perineal collection of the urine, perineal hematoma, but floating prostate is a feature of membranous urethral injury. So what is the high yield topic for the MD entrance exam, doctor? Extraperitoneal, intraperitoneal rupture. Definitely a question will be asked, doctor. So the ruptured bulbar urethra may we find perineal bruising, hematoma, etc., etc. Now you see, in this there is a complete rupture of the membranous urethra, but the urogenital diaphragm is intact. That's the reason extravasation is only limited to pelvis. But in this, there is both membranous urethra along with urogenital diaphragm disruption because of the injury to the bulbar urethra. The moment bulbar urethra get injured and perineal membrane get urogenital diaphragm get disturbed, there is an extravasation which occur into the perineum is what you have to ultimately remember. This is another very important question. In an individual less than 60 years, if there is a testicular tumor, then that would be germ cell tumor. In the individuals who are more than 60 years, it is a leukemia, lymphoma. They are the ones which are responsible for the formation of a tumor is what need to be remembered. Now doctor, persistent vomiting if it is there, intravascular volume contracts, that need to decrease blood flow to the kidney, that stimulates renin, angiotensin, aldosterone. Excess aldosterone will lead to sodium retention, potassium loss into urine. So there is a kaliuresis, not decreased K plus in urine, is what need to be remembered. Melanoma comes from the junctional melanocyte. It is the Wallace law, Wallace rule, Alexander Wallace rule of 9. Typically, the medial border of the foot and the medial side of the leg, they are all supplied by the saphenous nerve is what need to be remembered. Spleen is the most commonly injured organ in the blunt trauma of the abdomen is what you need to remember. Wharton's tumor, typically it is the facial nerve which is commonly involved and get injured in case of the Wharton's tumor. Carotid body tumors, from where do they come, doctor? They basically arise from paraganglionic cells, and rarely they can metastasize. Rarely they can metastasize. Around 2 to 9% of cases they do metastasize. Which tumors are called round cell, small round cell tumors, doctor? Ewing's sarcoma, rhabdomyosarcoma, lymphoma, non-Hodgkin's lymphoma. They're all called as, because the morphological appearance as the round cell tumors. Dysgerminoma and seminoma are the radio-sensitive tumors, as all of you know very well. This is a very important question, doctor. ALL में what are the prognostic factors? न्यूरोब्लास्टोमा में what are the prognostic factors? एक क्वेश्चन जरूर पूछा जाएगा एग्जाम में. RAS oncogene, N-mic amplification, bad signs. Hyperdiploid is a good sign. Is what you have to be encyclopedic. In renal transplant recipient, you will be surprised to know that the most common tumor will be a skin cancer, doctor. Skin and lip cancer is what you need to remember. If you transfuse the stored blood, what will happen? It leads to hypocalcemia because of the citrate content in it, not hypercalcemia. IV sodium bicarbonate, we use it in hyperkalemic individuals, not hypokalemic individuals, is what you need to basically remember. A 1-month-old small red macules, what is that basically called as? Infantile hemangioma is a benign vascular neoplasm which will undergo spontaneous resolution, is what you have to ultimately remember. So what is the main site of congenital tuberculosis primary focus? Let me ask our online classmates. To keep them without two-way interaction is no fun. Please punch your answer, doctor. Krishnamani, Karthik, Ritu, Tirupati, Balina, Sumit. Please punch. What is your answer? Let me guess. What are you going to answer? Very good. Krishnamani proposes lungs. Karthik is proposing liver. That gives a huge clap for Karthik NVKN that it is the liver, doctor. Primary complex in the liver. If the liver is not involved, then if the lesions are present within the first days of life, or if the TB is firmly established in the first few days, they are all considered with the criteria. Bedsky's criteria of congenital tuberculosis is what need to be basically remembered. Very good. I am happy to see Venkata also online. Please do punch your answers. Pseudocyesis. Come on. Please punch your answer. Let me check. What do you want to guess about pseudocyesis? Pseudocyesis. You think pseudocyesis, is there any age group involved? How will be menstrual cycles in them? Please punch your answer, doctor. I am asking you so that you don't feel sleepy in this long session. Yes. Very good. Oh, very happy to see Asha after a long time. So Asha proposes normal menstrual cycle as wrong. Beautiful. That's right. There will be amenorrhea. But amenorrhea will be confused for a pregnancy by them. It is more common seen in the young women, is what need to be remembered. Lateral condylar humerus fracture, doctor. One of the favorite questions. It is a Salter-Harris type 4. Tardy ulnar palsy is seen. Open reduction internal fixation has to be done because it is a type 4. You need a strict reduction. So there is no wrong statement among any of them. In myositis ossificans, this is a little tricky question. All these things are used, doctor. Both active mobilization and also passive stretching exercises is what you need to basically remember. Now, a child is pinned holding the hand by his father. Generally, the child will be saying, no, I will not come, and the parent will be pulling him. In the process of that, there is a development of what is called pulled elbow, also called nursemaid's elbow, is a dislocation of the elbow joint is what you have to ultimately remember. That's good. So what is Galeazzi's fracture? One of our student Kranti used to remind us, make easy to remember. Galeazzi hota hai galees hota hai niche. So niche kya hota hai? Inferior radioulnar joint dislocation. Inferior is galees hota hai Telangana bhasha mein. So inferior radioulnar joint dislocation is what you see in case of Galeazzi is what need to be remembered. Okay, doc? Occult fracture of the neck of femur. Typically, we see it with the help of MRI, which gives 100% sensitivity and specificity. Flexion, adduction, internal rotation of the lower limb. So, these are all the things that we see with posterior hip dislocation. So, I am very happy to see Dr. Arun and Dr. Karthik, who are our new components of this consortium. Please inform Rajni that two of the people whom she invited are the participants, Arun and Karthik. Please do inform. So, doctor, posterior hip dislocation. Posterior hip dislocation, you find flexion, adduction, internal rotation of the lower limb. So, what maintains the stability of the ankle joint is an important question. So, deltoid ligament, anterior talofibular, posterior talofibular, they are all involved, but not the spring ligament is what you have to basically remember. Now, doctor, Blount's disease is also called tibia vara is what need to be remembered. So, very happy to see Asha answering. Asha had been our regular companion for many wonderful evenings like this of academic sessions, participating in daily quiz, etc. So, we wish all those who were with us that full confidence without any regrets. Go, use your common sense, prevail on the questions, and then show that you have done that, called the top rank in the MD entrance. That is all about that, doctor. Next 2-3 days, relax yourself, feel free, confident, don't read any new things. You already know what to be revised by now. Just review. Just question paper will be the same way as what you are seeing the today's paper. It will be more or less the same way you will have the state MD entrance, which is going to happen on Sunday. That's good. Gustilo-Anderson's syndrome, classification. There is one nasty classification, doctor, for a tibial fracture. A open fracture with a clean wound where the wound is less than 1 centimeter is called grade 1. More than 1 but less than 10 is 2 and more than 10 is 3. In this case it is how much? 3 centimeters, which is more than 1 but less than 10. So that makes it grade 2 is what need to be remembered. Shoulder is notorious to have recurrent dislocations. Scintillating scudema is what you see in case of the migraine. Smokestack appearance, if you happen to do the fluorescent angiography, is a feature in case of the central serous retinopathy. This is a tricky question. Elevated episcleral pressure. What are the situations where you see it? So basically, if you look at the episcleral venous pressure and aqueous flow occur by a conventional outflow pathway which is dependent on the pressure gradient between the episcleral venous pressure and intraocular pressure, doctor. So, if the episcleral venous pressure happen to increase, that prevents the drainage and causes the increase of the intraocular pressure. So, these are the episcleral venous congestion. You can see in ophthalmopathy of thyroid, prominent episcleral veins. So, orbital varices, Stooge-Weber syndrome, AV fistulas like keratico-cavernous fistulas, in all these scenarios, the episcleral venous pressure typically increases is what you have to ultimately remember. Postner-Schlossman syndrome. I too came to know about it today only. So it is not involved with any raised episteal venous pressure is the point. So what is Arlet's triangle, doctor? Cyclitis. Cyclitis, whenever it is there, typically the convention currents will be carrying the keratic precipitates to accumulate in an area which is called as the Arlet's triangle is what you have to basically remember. Walk striae. Where do you see them, doctor? In keratoconus. That the stress lines within the cornea which are caused by stretching and thinning is what you need to remember. Retinoschis occur by the splitting of retinal layers in the nerve fiber layer. There are so many layers of the retina. Recent Comet-K and the recent Maharashtra paper which we have discussed, 2014 question papers we discussed now. So we have reviewed retinoschis, retinal detachment, everything are very high yield topics. Refractive surgery. We use the excimer laser in order to treat for the people who are having high-end myopias, etc., etc. Then strabismus is a dirty topic. One question is bound to come. So primary deviation will be less than secondary deviation. That is, secondary deviation will be more than the primary deviation paralytic squint. Secondary deviation will be equal to the primary deviation in case of the non-paralytic concomitant squint is what you have to ultimately remember. We discussed all this which is available in the ophthalmology online video library topic wise, and we are going to discuss once more very logically in the live classes which are going to come. So we will declare the schedule, reorganized schedule. So doctor, pupil is dilated, not in the hornets where there is a meiosis, easy question. Hornet anther spots are typically seen in vernal keratoconjunctiva, which is spring catra. If you do positive fistula test, if it's a dead labyrinth, you can't elicit it. Then radical mastoidectomy. What is the difference between radical and modified radical mastoidectomy? So by now you might have been experts in this field. Modified radical may posterior meatal wall is removed just like in radical. Mastoid and attic are exteriorized. Then tympanic membrane remnant, ossicles and function of eustachian tube are all preserved in case of modified radical mastoidectomy, and etc., etc. Now coming to the various structures, mastoid tip is absent but antrum is present at birth. That's what you need to basically appreciate. Maxillary is commonly involved. AS type is what you see in otosclerosis, the tympanogram. If there is any upper respiratory infection which is leading to mouth breathing, you can do adenoidectomy with grommet insertion is a wonderful way by which you can be able to treat. When do you call complete cleft palate? Complete cleft palate, tricky question. So when the nasal septum and the vomer bone are completely separated from the palatine process, then you call it as complete. If nasal septum and vomer, to that if the hard palate, cleft of the hard palate is attached, then you call incomplete. So vomer is the important structure that differentiates complete from incomplete. This question high potential to come in the tomorrow's exam, doctor, you need to be quite sure. Trotter's triad is what you see in nasopharyngeal carcinoma. Unilateral conductive hearing loss, ipsilateral earache and facial pain, ipsilateral paralysis of the soft palate is what you need to remember. There is a vestibule in the inner ear but not middle ear. Vestibule is there in the nose, vestibule is there in the larynx. Beautiful question, doctor. Hearing loss always is a very high yield topic in the topic list given to you in ENT. So you need to remember that noise induced trauma, very common cause of the high frequency hearing loss. Even drug induced ototoxicity, certain syndromes associated with hearing loss, in them also you find high frequency hearing loss. Whereas otosclerosis, Meniere's, malingering, it is not high frequency hearing loss is what you need to ultimately remember. Progesterone only pill, what is the difference, doctor? Unlike the combined pill whose main action is to inhibit the ovulation, progesterone only pill will not do it that way. That's what you need to basically understand. In Down syndrome, it is the nuchal translucency. The most reliable feature, 80% of cases you can detect it. I mean, Downs can be identified. Hormone replacement therapy decreases the risk of colorectal cancer, not increases. Whereas breast cancer, stroke risk, everything is increased. Now only two maneuvers, doctor, suprapubic pressure and Mac-Roberts maneuver. They are considered to be the first maneuvers which are utilized whenever the shoulder dystocia is occurring, is what you need to basically remember. Vasoprevia, there is a fetal blood which is involved. You don't give streptomycin, ACE inhibitors, aminoglycosides, so you need to be careful to give. Then Bishop's, you must be sure, the position, consistency, effacement, dilatation and baby station. They are the ones which are used for calculating the Bishop's score. Systolic murmur is physiological. There is nothing to worry about systolic murmur. Diastolic murmur or a raised JVP or central cyanosis, they are all the ominous signs. Pregnancy may, renal blood flow will increase, cardiac output will increase, GFR will increase, progesterone will lead to ureteric dilatation. They are all the true statements. Placenta previa increta, where there is an invasion of the wall of the uterus, what will you use, doctor? MRI can be of a great help. Laparoscopy is what you use in order to grade the severity of endometriosis. Menopause may, since estrogen is not produced by the ovary, FSH is uninhibited and FSH levels will become elevated, not decreased. Easy question. Anencephaly as early as 8 to 10 weeks you can be able to detect. Now doctor, of all conjugates we can calculate diagonal conjugate, and from that we can deduce the obstetric conjugate. Directly, clinically you can check the diagonal conjugate. Cleland's has got a sliding lock. Diabetic mother's baby will have hypoglycemic episodes because of the hyperinsulinemia stimulated by the maternal hyperglycemia. Then coming to the hypertensive women, ergometrin, it is one of the important contraindication, hypertension. Prolactin enables the milk production to happen. We use X-rays, gamma rays, beta rays, all of them for the radiotherapy.